Okay, good evening. My name is Ida Bernard and I'm trying to take my video for head to toe tonight. And before that, I just want to scan the room to make sure that there's nothing. And that's the ceiling. This is the bed, the floor on the side, the wall, and this is my working space. I have the blank sheet of paper with my vital signs, and that's the consent. Nothing more with the consent, just the sheets, the floor. Okay, thank you. So anyway, I'm going to start my assessment, and first is I'm going to introduce myself, Mr. Alan Bernard. I'm a nurse practitioner student at United States University, based in San Diego, California. And tonight I'm going to do your history and physical, which involves interview and physical assessment from head to toe. But before we start with that, I just want to inform you to make sure that if you feel uncomfortable, if there is any pain or discomfort, to let me know, please. Before we start, although I have sent the consent, I just want to ask you that it's okay with you that we are going to videotape the examination, and I will submit it to my teacher so she could review the process.
Yes, you can.
And before we start again, I just want to ask you, can you state your full name, your date of birth, your gender, and your age?
I'm Alan Bernard. I was born March 26, 1965. I am 54 years old and a male.
And are you here for,
Annual checkup.
so it's like a wellness checkup?
checkup.
Okay, so anyway, I'm going to start with interview. I'm just gonna stand while we are having a conversation here. So, can you tell me about your general health? Any medical issues? When was the last visit that you had with your primary care or any medical provider? And is there any latest labs or diagnostic test that you had? And if you are aware of the results.
Actually, I've seen my doctor last 2 weeks, and I have everything checked. My blood works, cholesterol, blood sugar, and everything is normal. And I have a history of hypertension, high cholesterol. I have asthma, and seasonal asthma, allergy,
So,
and I have a latex allergy too.
and with hypertension, are you taking any medications for that?
I'm taking amlodipine, atenolol, and the amlodipine is like 10 milligrams, and atenolol is 25 milligrams. And for cholesterol, I'm taking atorvastatin. And for my asthma, I'm taking albuterol and Advair, but as needed. My asthma and my asthma is well controlled, so I don't have too much of an issue.
So with your amlodipine, 10 milligrams, how often you take it per day?
Just once a day, as prescribed by the doctor.
How about your atenolol?
Just once a day too, as prescribed.
And your atorvastatin, how much are you taking?
14 milligrams as every day.
Okay. And your albuterol, do you know the dose for your albuterol?
I forgot.
So how many puffs do you take?
I took when I have an episode of asthma, like two puffs. But as what I said, it's well controlled.
So when was
It's only seasonal, like springtime.
So when was the last time you used your albuterol?
Just like springtime, that was in March or May.
Okay, how about your Advair?
Like 2 years ago.
So what's the dose of your Advair?
250 over 50 milligrams, I think. As far as I remember.
Okay. And how many puffs do you take for that as needed?
One in the morning, one in the evening.
All right. Okay. So any psychiatric history like any anxiety, depression, and if there's any history of hospitalization, if there is?
I forgot to mention. I have lately diagnosed like mild depression, so the doctor prescribed me buspirone as needed. And then I was hospitalized long time ago for gallstone removal.
So buspirone, how much is the dose?
It's low dose, like 5 milligrams or 10.
And you take it as needed as
Yes,
well?
needed.
Okay. So let's go to hospitalization. You have mentioned that you were in a hospital for what reason?
Gallstone removal, and there's another one. It's like a deviated septum.
So you have a repair of the deviated septum. Okay, any history of injuries?
Nothing, I know.
How about history of infectious disease?
Nothing, I know.
Did you have mentioned you were in a hospital because of the removal of your gallbladder. So what other surgeries you had?
What I said is like a deviated septum. That's
What-
all.
When was that?
That like 10 years ago. My gallstone like about 5 years ago.
Did you have any complications?
Nothing, I know.
How about are you aware of what kind of anesthesia was
No.
okay. So any history of allergies? I know you said you have seasonal allergies. You have
Yeah.
mentioned that. Any medication allergies?
Like a Certec over the counter.
No, I mean, do you have any so that's what you take for your seasonal allergies.
Yes.
So how much do you take?
Like 10 milligrams, say Certec or Allegra.
How much Allegra you take?
Just once a day.
What's the dose?
I forget the dose. But Certec is like 10 milligrams or 20 milligrams.
Once or
Once only.
You
Either
do-
way,
you do take it as needed or you take it as
every
scheduled?
day. I take it every day because, I have seasonal, environmental allergy.
Okay. Any allergies with medication?
Nothing I know.
How about allergies with food?
Nothing I know.
Any allergy with latex?
Oh yeah, I am allergic to latex.
So what reaction do you have with latex?
Just like when there's an open wound or like contact on my skin for a period of time. It's like weirdish. It's like
So
swelling.
it causes some swelling
Yeah,
and any rashes at all?
just a little bit red rashes when it's contact like bandage in that
Okay.
area.
So with the seasonal allergies, what happens when you get allergies? Do you go sneezing? Do you have teary eyes?
Yeah, sneezing, teary eyes. Sometimes my asthma aggravates, and that's it. Yeah, that's it.
Any history of alcohol use?
No,
How about smoking?
no, never.
Drug abuse?
No, never.
Are you updated with your immunization?
Yes, I do.
History, sexual history. Did you have any history of sexually transmitted
No, none,
infection or disease?
none,
Sexual partners.
none,
So it's the opposite sex, female.
none.
Female is your sexual partner.
Yes.
Okay. All right. Next is we are going to check your family medical history. So we are going to talk about your grandparents, your parents, your siblings, meaning your brothers and your sisters and your children. So you will please indicate to me whether if they died, what they died for, and what age did they die. So we're going to start with Head, ears, eyes, nose, and throat.
Okay.
Is there any issues for that?
For head now, eyes, throat now.
Okay. Cardiovascular.
Mm,
This is where it involves the heart, hypertension,
my dad died at cardiac arrest.
cardiac arrest.
Or heart attack or something.
At what age?
He died like 55 years old.
Okay. Anyone else?
Nah, nothing, no.
Okay. Any history of pulmonary problems?
Mm, nothing I know.
Any neurological issues like epilepsy?
None. No, history.
Okay. Any issues with the gastrointestinal, meaning it involves your stomach, your abdomen, your liver?
Nothing I know of.
How about genitourinary, which involves urination, the bladder?
Nothing I know of about
Okay. Any history of we mentioned neurological, any issues with endocrine? So this is where, diabetes comes in, hypothyroidism.
my sister has diabetes, and that's all I remember. Just only my sister is acquired, just like she acquired later age, like 40s, 50s.
Okay. Any problems with bleeding disorders, like when they have a cut, it bleeds long, and it
Nothing.
takes.
None.
Any problems with musculoskeletal?
None.
Okay. Any issues with genetics, like mongoloid? Any history in the family?
None.
Okay. Any history of substance abuse? Again, tobacco use, alcohol, drug abuse.
Nothing I know of.
Any history with obesity?
Nothing I know.
Cancer?
Oh yeah, my sister died and my mother died with cancer.
So your sister died of what kind
Breast
of cancer?
She died like 50 years old.
Okay, and your mother?
My mother died like she had a lymphoma at the age of 35.
Okay. And how about psychiatric history, like diagnosis of anxiety, depression?
Nothing I know.
And what about any allergies in the family?
Yeah, my dad
Okay.
into aspirin, and my brother seasonal too.
Okay. So next is we are going to check your social history. So first is I'm going to ask you your place of birth.
I was born in the Philippines.
And what's your nationality or
I'm
ethnicity?
Filipino Asian.
All right. What's your current occupation?
I'm not working right now. I am stay-at-home dad.
And your marital status?
I'm married and I have 4 kids.
What's your socioeconomic status? Meaning, example, your living condition.
I live with my wife and my 4 kids in a house by ourselves.
Okay. And also, any history of military work?
No,
Any health habits that you have? Do you drink caffeine?
I drink coffee like twice a day.
How about any exercise?
And that day, yeah, cause what I do exercise, walk on the mall, walk on the treadmill, like around like 4 hours a week.
How about how many glasses of water or fluids do you drink a
Like
day?
6 to 8 glasses.
Okay. And also any How's your sleeping pattern?
Oh, my sleeping pattern is normal. I sleep
Uh,
like around 6 to 8 hours.
Any stress?
Not really.
Okay. What are your hobbies or what do you do for leisure?
I walk on the mall, just the neighborhood. I do gardening and then cooking, reading.
Any history of I mean alcohol?
No,
How about smoking,
no,
drug abuse?
no,
And do you practice alternative medicine like yoga,
not at all.
meditation? Are you concerned of violence or your safety?
Mm, no, not really. I'm okay. I don't have any enemies or something like, and I live in a safe neighborhood.
Okay, so then we'll move to review of system. So I will start with are you having fevers?
No,
How about chills?
no,
Any fatigue?
not at all.
Any significant weight changes?
No.
Okay. So next is, I'm going to ask you if you have any issues with your eyes. Do you have blurring of vision?
Without glasses, I have a prescription glasses, so it's farsighted and reading. So aside from that, no,
All right. With your ears, nose, and throat, and with your head, do you have any issues like having headache or migraine headaches? Any hearing problems?
nothing.
Any chewing or swallowing issues?
No,
Pain in the mouth?
nothing.
Okay, how about cardiovascular? Are you having irregular heartbeat
No,
or
nothing. And
palpitation?
concerned of no, it's normal everything.
Okay, how about pulmonary or respiratory? Are you having shortness of breathing? Are you coughing?
No,
How about gastrointestinal? Again, this involves your stomach, your liver, your
nothing. I concerned of.
okay, how about experiencing constipation or diarrhea or
It's
regular?
normal, normal still.
Okay, how
Okay.
about your genitourinary? You know, your urination, are you having painful urination?
Normal,
Okay, any bleeding disorder?
nothing. I know.
Okay, how about endocrine? Are you having what do you call this? Sensitivity to temperature?
No,
Okay, how about musculoskeletal?
it's not everything normal.
Okay. Um, how about anything in your skin that you have observed? Any redness, any rashes, any open wounds?
No, it's normal. Everything is normal.
How about your hematologic and lymphatic area? Are you having um, problems with healing, like it prolongs with healing? Do you get easily bruising?
Oh no, it's normal. I don't have an issue with cut that doesn't heal longer. No, it heals like few days, and no bruising at all.
And how about your any allergic or immunological issues, like you get sick with infection easily, your immune system is low?
No, not really. Just like usually it's like seasonal sometimes during when it's cold. It's not like a small temperature change getting sick easily. No,
So how about any issues with mental or emotional?
nothing.
Okay. So I'm going to check. I already checked your vital signs and your height and weight. So I'm just going to start my physical assessment. So Mr. Bernard is healthy, well groomed, good hygiene, alert and oriented times 4. He maintains eye contact during interview, and he wears eyeglasses, and also have a clear speech. So as I've said, vital signs, I have 120/84, 20 respiration, 78 is pulse, 97.7 temperature, 96% oxygen saturation, room air. He's 5'6" tall and 210 pounds. So before we go further, I'm going to check your visual acuity. So because you mentioned that that is prescription eyeglasses, I'm going to let you wear that, and I'm going to let you read the smallest letters. But first you cover your one eye, and then you uncover that and do the opposite eye, and then read by both eyes. So if you can read the bottom.
LTFPH.
Okay, do the other one
LTFPH.
and read it both.
LTFPH.
Okay, so vision is 20/20. So next to that is I'm going to check your skin, your hair, and your nails. So I'm going to check the skin for any discoloration, moisture, if there's any dryness, if there's any rashes. And then I'm going to check the skin, the hair, and the nails. Check the hair for distribution, for the texture, if there's any alopecia, and also if there is jaundice, bruising, clubbing of the fingers. And also I will check the skin. If you can take off your shirt, please. For any scars, just like him, he has, I could see that there's some scar in the abdominal area here, just small ones like punctured. There's 3. And also to check if there's any vascular or any lesions, and so far he doesn't have any. And also I'm going to check for skin turgor. Okay, so that would be for the skin. There's no any changes. There's no bruising, ecchymosis, PTK, or any macules, papules, or vesicles. Next is I'm going to do the HEENT examination, the head, the ears, the eyes, the nose, and the throat. So I'm going to inspect the head and the neck, going to check for appearance, facial expression, check for the head for any trauma, for any malformation. I'm checking for the hair distribution. And next is I'm going to palpate the sinuses and the temporal artery. So let me know if there's any pain.
No.
Any pain or tenderness?
No pain. No pain.
Okay, so next to that is I'm going to check for cranial nerve number 5, which is the trigeminal nerve. I'm going to check for the motor and the sensory. So for the motor, if you can move your jaw with resistance. Okay, side to side. All right, thank you. And then next is, please identify with your eyes closed if I'm going to touch your forehead, your cheek, and your chin, whether it is dull or sharp.
Dull. 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 Sharp. Sharp. Sharp.
Okay, So next one is I'm going to check for cranial nerve number 7, which is the facial nerve. Would you please smile for me? Okay. And then puff your cheek. All right. So that would be for cranial nerve number 7. Next is I'm going to inspect the eyes. So I'm going to inspect the eyelids, making sure there's no ptosis. I'm going to check for the sclera, the conjunctiva, the pupils, the lens. The sclera is white, the conjunctiva is pink. Next is with the use of my pen light, I'm going to check for pupil reaction, so and constriction. So anyway, it's called perla, which means pupils is equal, rounded, reacting to light and accommodation. So with the use of my pen light, let me see. Okay, all right, one more. And then it's the pupil is constricting, and then I'll check for accommodation. You look at the pen while I'm moving it, and then the pupils will constrict as I go closer. So that would be testing for perla. Next is testing for eye ocular movement. So this is for cranial nerves number 3, number 4, and number 6, which is the oculomotor, the trochlear, and the abducens. So while I'm performing this test, what I need you to do is just follow the direction of my finger, but your head should not be moving. And at the same time, I'm going to check for nystagmus. Okay, so there's no nystagmus noted as well. And next is I'm going to check for the optic nerve with the use of my ophthalmoscope. So I'm going to use my right hand for the right eyes. Okay, I could see the optic nerve, also the blood vessels there. Okay, I'm going to check with my left eye. Okay, there you go. I could see the optic nerve. So that would be with the eyes. Next is I'm going to check with the ears. First is I have to do inspection, making sure the symmetry, and also there's no obstruction of the external canal. I'm going to palpate to check if there's any pain, and then I'm going to test for hearing, which is acoustic nerve. So what I need you to do is to cover one of your ear, and then let me know what did I say. 1, 2, 3, 4.
1, 2, 3, 4.
Okay, cover the other ear. How are you?
How are you?
So that would be with the whispers test. And then with the use of my tuning fork, I'm going to test for Weber's test. This is testing by putting the can you hear the vibration?
Yeah.
Okay. Next one is I'm going to put it on the side of your ear. You tell me when it stops.
Okay. Stop. Stop.
Okay. So that is checking for you know, the air conduction and the bone conduction, and the air conduction should be more than the bone conduction. So next is after that, I'm going to use my otoscope. And I'm going to check the ear. So being an adult, I have to pull it up and backward, and I'm checking for the inner canal. It's clean, mucous membrane pinkish. The tympanic membrane is shiny. I could see that it is grayish, pearly grayish, and the cone of light is at 5 o'clock. The left ear, okay, I'm checking, there's no bulging of the tympanic membrane. It's pearly gray, and the cone of light is at 7 o'clock. There's no drainage, there's no redness in the ears. So next is I'm going to check the mouth and the throat. So again, I'm going to check for, before that, I'm going to check the nose first. I'm going to check for symmetry, if the nostril is patent. So if you can cover one of your nose and then breathe on my, okay, and do it on the other side. All right. And also I'm going to check the turbinates using my otoscope here. All right, so I'm going to check the mucous membrane. There's no drainage. Okay, mucous membrane is pinkish. There's no drainage as well. And the next thing I have to check is the sense of smell, or cranial nerve number 1. So with your eyes closed, cover your one nostril and tell me
Sorry.
and tell me what do you smell?
Vanilla.
Okay, let's do the other side.
Same. Vanilla.
Okay, thank you. So then this is the time I'm going to check for the mouth and the throat. So will you so I'm going to inspect again first, you know, the lips for any dryness, any paleness, any cyanosis. And then can you open your mouth for me? So I'm going to check for the gums, check for the uvula that is midline, check for the teeth for any dental cavities, any abscess, check for the soft palate and the hard palate, and also check the tonsils. Tonsils is actually grade 2. There's no redness, there's no swelling, there's no white patches on it. And then this is also the time that I could check for the cranial nerves, number 9, number 10, and number 12. This is the glossopharyngeal, the vagus, and the hypoglossal nerves. So what I'm gonna say, if you can say ah. Okay, the uvula is in the midline. Also, if you can swallow, please. All right, I can use also the tongue depressor to check for gag reflex, tongue out. Okay, and if you can move your tongue side to side. All right, so that would be cranial nerves number 9, number 10, and number 12. Okay, next to that is I'm going to inspect for the neck, making sure that it's symmetrical, and then I'm going to palpate for the I'm going to palpate for the lymph nodes. So this would be for the pre-auricular, the post-auricular, and then I have the occipital at the back. Then we have the tonsillar, and then we have the submandibular, and then the submental, and then the pre-cervical, the post-cervical, and then the supraclavicular. And also, I'm going to check cranial nerve number 11, which is the spinal accessory. So you shrug, and I'm going to, okay. And then next is I'm going to check that the trachea is in the midline. Next to that is I'm going to check for the thyroid, if you can just swallow. Okay. And then I'm going to check it posteriorly. If you can, I'm going to palpate, and I could move the thyroid gland here. It is actually just below the cricoid cartilage. And then I'm going to check for the jugular vein distension. So I'm going to request you to lay down. Alright, so if you can kind of turn on your side, so I'm going to visualize the external jugular vein, and then I could sit here, and then I have to look for pulsation, and that would be the internal jugular vein because it is deeply seated, so it could not be palpated. And then because the pulsation is below the midline of the neck, I have to adjust the head of the bed so it moves towards the midline. And then I'm going to measure using a measuring material that I should put by the sternal notch, and then measure it horizontally here and vertically using another equipment that should be at the highest point of the pulsation, and then measure. And the normal JVD should be between 2 to 4. Below that and above that is an abnormal finding or an abnormal reading. Okay, next one is you can sit down again. So we're done with our HEENT. I'm going to do your thoracic, or the chest, the lungs, and cardiovascular assessment. So at first, I'm going to again assess or inspect anteriorly and posteriorly appearance of your chest. If there is, check for symmetry, check for any discoloration of the skin, and then I'm going to assess also if there's any abnormal respiration by watching or assessing the respiratory rate, the rhythm, if there's any use of accessory muscles, as well as if there's any diaphragmatic breathing. Then I have to palpate the sternum. Is there any tenderness?
No.
Okay, and then at the same time I could check for skin turgor. Alright, and then I'm going to auscultate for lung sounds. Take a deep breath. Okay, so I'm going to start posteriorly. So I'm going to inspect again for symmetry. Then I'm going to palpate the intercostal muscles, the intercostal spaces, and then the spine to make sure that there's no tenderness, and just palpating posteriorly. Next is I'm going to palpate using the edge of my palm to check for tactile fremitus. Can you say 99?
99, 99, 99, 99, 99, 99, 99, 99.
Next is I'm going to check for respiratory excursion. I'm holding my hand like you know, a butterfly here, or the wings of an angel, and I will ask him to do his respiration. So if he exhales, my hands move upwards or also together with his respiration. Okay, go ahead. Okay, so there you go. My hands follows. Okay, and that is for respiratory excursion. Next is I'm going to do percussion. So with the third finger of my non-dominant hand and the dominant third finger of my dominant hand, I'm going to percuss. And the next thing I'm going to check is for the diaphragmatic excursion. So if you can inhale and hold it for now, and then I'm going to percuss. And here I could have the first downness. And I'm going to mark that. And then if you can again just take a deep breath and then exhale and then hold your breath. Okay, so I hear the first downness on the anterior part, and I'm going to measure. And it is 6 centimeters. And the normal should be for the diaphragmatic excursion is 3 to 5 centimeter. All right, so that would be for the diaphragmatic excursion. And then I'm going to auscultate the lung sounds. So every time you feel the stethoscope, if you can take a deep breath for me. Okay. All right. Okay. Okay, so that is auscultating posteriorly. Then I'm going to check for the anterior thorax, and then I'm going to palpate. So tell me if you feel any tenderness or pain when I palpate your chest.
No.
Okay, next is I'm going to palpate for tactile fremitus, again with the use of the edge of my palm. So you have to say 99.
99, 99, 99, 99, 99, 99,
And after that is I have to do percussion again, and with the use of my uh, dominant non-dominant third finger, with my dominant third finger, tapping it, it will elicit sound. Okay, and if while he's taking a deep breath, I'm also watching for lung chest expansion. And again, anteriorly, I'm going to auscultate the lungs. So again, every time you feel the stethoscope, take a deep breath. Okay, very good. Okay, so next is the cardiovascular. So again, I start with inspection, making sure that I don't see any heaves or lifts, or any abnormal pulsation. And then I'm going to palpate again and just check for any abnormal pulsation again, or heaves and lifts, and then check for the maximal um, pulse of maximum impulse, which is on the fifth mid-clavicular line. Okay, and then after that, I'm going to auscultate with my diaphragm and the bell of my stethoscope the aortic valve, pulmonic valve, the Erb's point, the tricuspid valve, and the mitral valve. So the aortic valve is on the right side by the second intercostal space. This is the pulmonic valve, again, is in the left side by the second intercostal space. Then on the third intercostal space by the left sternal notch would be the Erb's point. And then on the fourth intercostal space by the left sternal notch would be the tricuspid valve. And the fifth intercostal space by the mid-clavicular area would be the mitral valve. Okay, so I'm listening for the pulsation. Next is I'm gonna use my bell and listen on the same spots. The aortic valve first, then this is the pulmonic valve. Then I have the Erb's point, the tricuspid valve, and the mitral valve. And then after I listen to all of those, I'm going to check for the carotid artery. I'm going to palpate, and then I could feel it here, and then I'm going to listen with my stethoscope. Okay, so that would be with the cardiovascular system. Next is I'm going to do the abdominal system. So what I'm gonna ask you to do is if you can lay down. Alright, so first is I'm going to inspect the abdominal area, making sure that it's symmetrical. Check for any abnormal peristaltic movement, which is an obvious peristaltic movement. Check for any discoloration, if there's any jaundice, if there is any rashes on the skin, if there's any distended vein, and also I have to check for the contour, whether if it is rounded or protuberant. Next is I'm going to auscultate for vowel sounds, which the direction should be from the right lower quadrant, then right upper quadrant, the left upper quadrant, then the left lower quadrant. Normally, vowel sound should be 5 to 35 per minute. And the next is I'm going to listen for bruit for the abdominal aortic artery, which is below the epigastric area and above the umbilicus. Next is I'm gonna listen to my to the renal artery. And then to the iliac artery. Okay. And then I'm gonna listen to the femoral artery by the inguinal area. For privacy purposes, I did not, open it up. Anyway, so after listening for bruit, I should be doing my percussion. So I'm going to percuss on the same direction, right lower quadrant to right upper quadrant, the left upper quadrant, and the left lower quadrant. So again, with my non-dominant third finger with my dominant third finger. Oh, okay, I could hear that bell sound now. Okay, I'm going to percuss for the liver span. So from the just in line with the umbilical area, I'm going to percuss and listen to the first vowel sound, because the sound should be tympanic in the abdominal area. Okay, so that's where I hear the first vowel sound. And then from below the nipple line, I'm going to percuss going down. Okay, so that's where the vowel sound is. And I'm going to measure the liver span, which is 7.5 centimeter. Normal should be 6 to 12. Then I'm going to percuss for the spleen, and it should be on the 6th intercostal mid-axillary line. Okay, I can hear dullness in here. So that would be the border of the spleen. After percussion, I'm going to do palpation, which at first I'm going to do light palpation. Any pain or tenderness?
No.
Okay. Next would be deep palpation. So sometimes you can use 2 hands to do deep palpation. Any pain?
No. 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 No.
Okay, so now I'm going to palpate for the liver. Any pain when I do that?
No.
Okay. All right. And for the spleen? All right. And then I'm going to let you sit on the side of the bed. I'm going to check for the kidneys. I'm going to palpate the kidney, and then I'm going to palpate it on this side.
No pain.
All right. And then I'm going to do CVA costal vestibular assessment. So I'm going. Any pain?
No. No.
Okay, and that would be the CV, and then I'm just gonna let you know that I'm checking if you are doing the TSA, which is the testicular self-examination. It should be done every month while you're taking a shower. Like a warm shower could help actually relax the muscles, and then you can palpate your scrotal area using your thumb and your other fingers, and then you can roll it while palpating it, and you can feel, you know, if there's any lumps or nodules present, and if there's any pain, and you can see if there's changes every month. Okay, so also I'm going to as part of the abdominal examination, if you can go back here.
Lying down.
Yeah. I'm going to actually palpate for the aorta and feel for masses. Okay. And then also palpate the femoral artery as well as the inguinal lymph nodes. Okay. So that concludes the abdominal examination. All right, I could let you sit again. If you can sit sideways for now. Okay, so next is I'm going to do the spine, basically the musculoskeletal system, which involves the upper and the lower extremities. So again, I'm going to check the spine for any abnormalities, any bulging, check for symmetry, and then I'm going to palpate the spine. Okay, making sure that there's no bulging here that I could feel. So I started from C7 going down, and then I'm going to ask you to stand. So I'm checking, and then if you can bend forward. So by bending forward, I will be able to see if there's any problems with the curvature of the spine, like scoliosis, kyphosis, lordosis, and then I'm going to let him perform range of motion of the spine. So one would be bending forward, like you're touching your toes. Here, face that, okay. And then bending backwards. Okay, very good. And then bending on the side. Okay, all right, bending on the other side. Okay, and then twist your, okay, all right, so that would be with the spine. Thank you. Next is you can sit down. I'm going to do the upper extremities, so it will involve the hands, the wrist, the shoulder, the elbow and the shoulder. So I'm going to inspect, check for any inflammation, redness, swelling for both. Next is I'm going to palpate that there's no tenderness, again checking for any swelling. All right, okay, in your elbow and in your shoulder. Okay, same on the other hand, the fingers, the wrist, just palpating. All right, the elbow, and then the shoulder. So next is I'm going to ask you to do the range of motion of the upper extremity. So we are going to start with the fingers. So the fingers could be flexion, just the fingers, extension, okay, and then abduction is away from the body, you spread it out, and adduction going back, okay. The same with the wrist, we do flexion and then extension, and the wrist could again do abduction and adduction. So abduction again is away from the body and then inwards towards the body. Then we have the elbow. The elbow is again flexion and extension, and then the elbow will do pronation and supination, pronation and supination. Next is for the shoulder. The shoulder actually could flex and extend going backwards. You can stand probably so it could be seen better, okay, and then backward, and then the shoulder also can do internal and external rotation. So you hold your neck, like scratching your neck, and then extend it towards your shoulder blade, okay. And then it can do also away from the body, which is abduction, and towards the body, adduction, okay. So I didn't see any limitations there, and that would be for the shoulders, okay. Next one is I'm going to feel for the epitrochlear lymph nodes and the axillary lymph nodes here, okay. I'm trying to palpate the axillary lymph node. And then next to that is I'm going to check for the radial pulse, and also I'm going to check for the capillary reflex, okay, by pressing, and it turns pale, and then when I release it, it becomes pinkish again. And next to that is I'm going to check for the sensation. So you tell me whether it's dull or sharp, okay.
Dull, 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 sharp, sharp, sharp.
Okay, and then next to that is I'm going to do the deep tendon reflexes. So you want to sit down while we're doing this? Okay, so first is I'm going to check for the biceps. So just relax for me. Okay, with my, all right, it's really good actually. Then the biceps, okay, and then the brachioradialis. Okay, so those are three positive deep tendon reflexes. The next one is we are going to do the lower extremities. So I need you to stand up. So I'm going to inspect, check for the hips, if they are even, and then the knees, check for any, you can sit again, sorry. You can check for any swelling. The same with the ankles and the toes, and also palpate. I did palpate the hips already, making sure they're even. Palpate for any swelling, all right, and then the ankles and the toes. So next to that is I'm going to ask you to perform the range of motion of the lower extremities. So we will start with the hip. I think I'm just gonna, for the sake of better visualization, I'm gonna let you stand. So we'll start with the hips. So the hips, actually flexion is if you can put it towards your, yes, and then extension is going backwards, okay, and then we can do abduct, which is away again from the body, and then adduction is towards the body. And then we can do internal and external rotation, which is when you say external, you kind of twist, and then internal rotation. Okay, so that would be for the hip range of motion. Next is the knee. So the knee is flexion and extension, flexion and extension. And then for the toes, we can do dorsiflex in the ankle, and then plantar flexion. Okay, all right, so that would be for the lower extremities range of motion. And then next is you can sit down, and then I'm just gonna let you lay down so I can see. I'm going to palpate for your pulses so it can be better visualized in the cam. So with the lower extremities, I'm going to palpate for the popliteal, which is behind the knee. So with my two hands cuffed in the behind the knee, a little bit flex, I can feel the pulsation here. And then the dorsalis pedis, okay, and then the posterior tibial pulse by the malleolus area. So that would be for the pulses. And then next is I'm going to check for the deep tendon reflexes again. So can I let you sit just by the edge of the bed? So relax, and I'm going to check for the patella reflex. Don't look. Okay, so that would be the patella reflex or the knee reflex. And then if you can lay on your stomach so we can really visualize the Achilles tendon. Okay, so that would be another reflex. And then the Babinski reflex is like a C, and you see it's negative, the toes did not fund. So that would be for lower extremities. And then we are going to test your balance, your coordination. So I need you to walk. First is walk in one line. Okay, and then you can go back, and then I need you to walk in your toes. Okay, you can go backwards again, and then you can walk in your heels. Okay, so that ends and concludes our H&P. Thank you.